Hi, I'm Leslie Nance, your holistic cancer coach, and today I'm diving into a topic that is as fascinating as it is controversial. Ivermectin. Yes, that ivermectin. You know, it's been called everything from a miracle cure to a complete myth. But what's the truth? Today, we're going to go right to the topic and cut through the noise and look at the facts. No politics, no fear-mongering, just bold, disarming truth about how ivermectin is being studied in one of the toughest cancers to treat. So let's get into it. Ivermectin is being studied for one of the peskiest and most difficult cancers to treat, which is triple-negative breast cancer. So let's start with some context. Triple-negative breast cancer, or mTNBC, is a type of breast cancer that doesn't have the common markers estrogen, progesterone, or HER2 protein. And that makes it harder to treat because those markers are what many therapies target. Now, when this cancer spreads or becomes metastatic, it's even more challenging to manage. And that's where this innovative therapy, like the combination of ivermectin and another drug called balstilimab, comes into play. So why are researchers even looking at ivermectin? Isn't that a drug for parasites? Yes, but it's also shown some pretty interesting potential in preclinical studies. Lab research suggests it may disrupt how cancer cells produce energy. It may interfere with their ability to repair themselves and even trigger cancer cell death. And that's enough to justify taking it to the next steps, testing it in human trials. And let's be clear, this doesn't mean that ivermectin is a cure or some secret treatment that's being hidden from you. It's being studied openly and scientifically. It's all pretty exciting. So let's talk about the trial. It's a phase 1-2 study combining ivermectin with a drug called balstilimab. And here's the breakdown. Phase 1 focuses on finding the safest dose of ivermectin when combined with balstilimab. And phase 2 checks if the combo actually works, like shrinking tumors or showing cancer progression. And patients in the trial are receiving balstilimab through an IV once every 3 weeks, while ivermectin is taken as pills on specific days during the cycle. And it's aimed at adults with metastatic triple-negative breast cancer, particularly those tumors who don't express a protein called PD-L1, which makes cancer even trickier to treat. Balstilimab is a quiet star of the trial. It's a type of immunotherapy that helps your immune system recognize and attack cancer cells by blocking a kind of shield that cancer uses to hide in. It's part of a new wave of drugs revolutionizing cancer treatments. And why does all of this matter? Because metastatic triple-negative breast cancer is one of the hardest cancers to treat, and this trial represents hope. Not a guarantee, but hope. It's also a reminder that science takes time and there's no shortcuts to finding safe and effective treatments. Here's what you want to know and take away from this video. 1, ivermectin is not hidden. It's being studied in clinical trials. 2, it's not a cure yet. The research is promising, but we're not there yet. And 3, this is a process that is slow for a reason. Clinical trials exist to protect the patient and ensure treatments are both safe and effective. And 4, healing has no room for politics. We owe it to every person facing cancer to pursue this truth with integrity. Now, I know this is a lot to unpack, and you probably have a question or opinion even, and I'd love to hear them. So join me in my Facebook group, the Cancer Box Club, where we have real open conversations about topics just like this. It's a safe space for support, facts, and connection. The link is in the description below this video, and if this video really resonates with you, make sure that you hit the like button and share it with someone who might need it. And don't forget to subscribe for more empowering content. Let's keep the conversation going. I want you to remember that healing starts with truth, and you're not alone in this journey. Until next time, I'm Leslie Nance, the Holistic Cancer Coach, and you've got this. Stay bold, stay informed, stay empowered.